Welcome to Healthy Living. My name is Don Pelto, and I have Dr. Kim Elia. She's a physical therapist locally here in Massachusetts. Welcome, Kim.
Thanks for having me, Donald.
You're welcome. I was curious, and we got from a mutual friend kind of an introduction to each other, and you kind of have a unique format in terms of physical therapy. So tell me a little bit about your history with physical therapy and kind of how you developed this kind of a different niche.
Sure. So I've been in the outpatient orthopedic kind of realm of what I call traditional physical therapy for about 10 plus years. You go through the movement of learning new things and getting your experience with different clinics and, meeting a bunch of different patients and getting referrals. And over time, you start to notice that PT has kind of delved into what I call fishbowl of healthcare, where a lot of patients are getting the same treatment over and over and over. So a typical referral, what I'll see in a prescription is 2 times a week for 6 to 8 weeks. And, I was coming to find that with the traditional 30, maybe 40-minute appointment, you're trying to not only get in education to the patient, their home program, anything you might need to review, manual therapy and exercises all jammed into that time, all while trying to form that rapport with patients. So you do want to chat with them during the time, but when you're trying to get them better faster, you're really squeezing all this into a quick visit. And I think that's what, pushes us towards that 6 to 8 weeks, because you need that amount of time to fix the issue if you're limited. Mm-hmm. So over time that starts to get to you as a PT where you're thinking, man, I can fix this person so much faster if I just had a little bit more quality time with them, spend a little bit more time hands-on and really hone in on the exercises they need versus giving them filler exercises.
Busy work.
Right. And what I mean by that is just what you said. It's busy work to fill time, and I don't do that. It's not needed. People generally don't really want to have the time to go to PT or have the time to do this stuff at home. So keeping it at, exercises that they need to do and the ones that'll be the most effective at getting rid of their issue is kind of the way I've gone into my own practice. So the way I've decided to open up my business in the past couple of years is to really hone in on quality treatment. I spend a full hour with the patient with the evaluation, as well as any follow-ups they might need. Spending, however long they need with the hands-on technique, and then really educating them on form and technique with the needed exercises, which, may only take 10 or 15 minutes to do versus the traditional, people go home with 30 minutes of home exercises that they may not need.
They don't probably do.
Right, because it takes too long. And I can't blame people for that, because if I was told go do this 30-minute, episode of PT every single day, that just don't have 30 minutes. So if we're really focused on the quality of what you're doing, most people are compliant. They get better faster. And on average, I'd have to say visit counts for people before they get discharged is about 3. So that's obviously not 3 weeks in a row, because some things don't heal that fast. It may be a typical appointment for me would be someone comes in, we do an evaluation, I treat them, they go home with their exercises. Now, in most cases, it's going to take 2 full weeks of really focused attention to those exercises before I need to see you again. And part of that is I don't need to keep manipulating or doing certain things as long as you're doing your exercises. So when people are compliant, I don't have to have people coming in twice a week for 6 to 8 weeks. It may be the evaluation, 2 weeks later, you come back in, I strip everything from the home program and give you a new progression of exercises because you've gotten to that next level. And then depending on symptoms and progression with goals, you may come in either 2 to 4 weeks after that for another visit, but that it differs for every single patient. But on average, I'd say after 3 visits for most cases, orthopedic wise, you are good to go, you're pain-free, you're back to what you're doing.
Wow.
You don't need me anymore. And that's great. I don't want patients to rely on PT. I don't want them to rely on anybody but themselves.
Mm-hmm.
So the thing that I try to do is I educate my patients, you know, if this happens again, for some reason, you now have the tools in your toolbox to start working on what you need to. You know
Yeah.
what's going on. You go back to the first visit of exercises and you work on those.
And
Yeah, go ahead.
who taught? Now this is taught. How did you learn this? Did you have a mentor or someone else? Because I don't know anyone else that treats it like this, and there's a lot of PTs around here.
Right. Yeah. And, you know, I think part of it is experience. So knowing exactly, you've got to treat the cause, first of all. And I found that a lot of times in the outpatient world, because it is so busy, and just like you probably know, and every doctor out there knows, you're forced to see X amount of patients a day. When you're that busy, you know, sometimes you don't really go after the cause of the issue, you're symptom treating.
Mm-hmm.
And let's just say foot and ankle in this case. A lot of times it may not even be coming from the foot and ankle, and it may be coming from the hip.
Usually it's the hip or the core or Aquinas
Right.
or something else like that.
Right, exactly. So if someone is focused on the foot and ankle because there's pain down there, but they fail to treat, in this case, the hip, the spine, the core, then they're going to need that 8 weeks because you got to go to the cause at some point. It may take 4 weeks to that even happening. So I try to get to the cause immediately, fix what's going on so the symptoms elsewhere go away. And, you know, it's more of what makes us happy in life. If you're working, you should love what you're doing. If you're treating patients for 8 weeks at a time and you're seeing such slow progress, that didn't really make me happy over time. Knowing that I can get them better faster with a different approach, that makes me happy. I like people to have their goals, want to get better, listen and take in the education that I'm giving them, and work for themselves along with me, communicating on how to get to that point as fast as possible. So I have had a few mentors in my past that have, you know, both been in education and in PT. And a lot of PTs and outpatient specific, just because it's so fast paced, do get burned out. I did not want to go down that path. And in that realm with the mentors giving me advice, you know, everyone says, don't get caught in that.
Yeah.
Well, not. It's very red tape with, you know, some insurance issues with documentation, and it's not necessarily their fault, but I didn't want to get caught up in all of that.
Yeah. And Kim, so give me some example. I know you were saying that you treated people in other states and things like that. I don't know what we can talk about. What do you love treating? What would you treat every single day? What are the best types of patients that you feel like you can help the most? And tell me kind of some success stories.
Sure. So a lot of people say, why don't you specialize? And I don't like to specialize because going through school, you learn so much. And having a day that has a bunch of different diagnoses in it is great. It keeps me moving. It keeps me, you know, really thinking about how the body interacts with one spot versus another. And I don't want to lose that. So my ideal day would look like a variety of patients, but if I had to pick a certain diagnosis, I'd probably go with two different ones, the SI joint and actually the foot and ankle. I feel like those actually do go together fairly well with a bunch of different diagnoses, and it can be coming from anybody. It can come from a runner who stepped off a curb funny and jammed up their hip. Now they have foot pain. And it could be from someone leaning over in their garden who kind of was sitting kind of funny on their knees or something, cleaning up those areas. So working with that variety of people, I feel, you know, get better a lot faster with the techniques that I do. But I'd have to say my forte is runners. I'm a runner myself, and I've had the gamut of issues I think most of us go through with running. And I feel your pain, so to speak, when someone comes in and they're like, oh, I have a race coming up in 2 weeks. Am I going to be able to do it? Most of the time, again, from experience, most PTs, if they're not runners, are going to tell you to stop running. And a lot of times that could be true if they're symptom treating, but a lot of times you don't actually have to stop depending on the injury.
Correct.
It's more of, we can manage this fairly easily. And as long as we're attacking the cause, we can run through, a little bit of pain that isn't necessarily a bad thing. So that's probably one of the greatest things when I get runners in, specifically before marathons. Our bodies are pretty fatigued after 10 weeks or 12 or 14 weeks of training. We're starting to fatigue out and get injuries, and getting those people on the starting line and ready to go is pretty rewarding to me.
I bet, Kim.
Yeah.
And in terms of, you talked a little bit about this before, about how you progress the patients along. I've been very aware of this 2 to 3 times a week for a number of weeks. I don't really write that, but I always have people look at like the core, the quads, ITs, everything else that's usually prox. It's how your body moves over your foot, for my specialty anyway.
Right.
And a lot, I think Aquinas is the root of all evil, ultimately, because we've been sitting so much.
Right.
And especially during the pandemic. Let's talk about just some general overall. Let's say you get someone kind of on the mend, or a runner. Do you have any kind of unique ways of thinking about injury prevention? Do you like foam roller? Do you like certain types of shoes? Do you like barefoot? What type of things are in your toolbox that you like to share with people?
Right. So a lot of times, since everyone's a little different, people like have different opinions on things. I do think with people running and really training hard for races, the foam roller is almost a must. People can get away with it just with basic running and some stretching, but I do think having some stretching, some foam rolling are key to maintaining flexibility. If your muscles are too tight, the muscles attached to the joint gets stiff, and usually the joint stiffness is what's going to lead to some issues somewhere else. So attacking the muscle tightness with stretching or rolling before causing that joint stiffness is important to me for injury prevention. And then the second thing is just some basic hip strengthening and ankle stabilization. So stabilization in this case would be more balance oriented to prevent sprains and overuse. And then hip strengthening just to reduce the amount that your calves and hamstrings have to take on, so you don't have issues like that.
Yeah, I have kind of my own opinions. I don't like to guide people, but in terms of running, any certain running styles, like, do you like chi running? Do you like other things like that? Have you looked into any of that stuff?
So I actually don't. And it's funny you bring that up, because I actually do gait assessments, but I don't own a treadmill in my clinic. And to most people that would be like, oh my God, what are you talking about? But if you teach somebody a certain type of gait and they don't have the proper mobility or flexibility in certain joints, you're causing that person to compensate. So the cues that you offer that person may actually be inappropriate and cause other issues down the road. So the way I attack a gait assessment is I actually assess their body on the table, off the table first, to see where their limitations are. Mm-hmm. Adjust those limitations more towards what I'd consider a normal position of the body, and then start to look at their gait and positioning. So out of any of the cues that I would give somebody, just as a generalization, is more of that forward tilt from the hips with a straight spine, because most of us runners tend to be more upright with a little bit of an arch in our back. And we need to get that lean a little bit so our foot drop is more underneath us versus too far forward.
Mm-hmm. And in terms of like physical therapy, I know some places I send to, they like doing all these modalities, and my back of my mind, I'm thinking, I wonder if that's maybe it reimburses better to do all these modalities. But what modalities, for those that are listening here, like what things do you use? Ultrasound, Graston, what types of tools do you use, it, or just your hands? What do you like to do?
So it's mostly just my hands. And part of the reason for that, we'll go into ultrasound, for example. There's plenty of research articles out there showing that when the ultrasound machine is on versus when it is off, so literally unplugged from the wall, you have the same results long-term. There's plenty of research showing that. So I don't own an ultrasound unit because I don't want to spend 8 to 13 minutes on ultrasound if it's not going to be the ideal thing to attack the pain. Yes, I agree there are some things that it may benefit from, but with the amount of experience and the research, I just don't necessarily agree with that as a useful tool. The things that I do use are Graston technique, but with that, I'll use it as, you know, a precursor or an addition, we should say. You can feel with your hands what's going on with the tissue, but when you use a tool to do some soft tissue work, you're not feeling through the tool.
Mm-hmm.
So I'll use that with the pressure I feel needed, and then I'll backtrack and assess with my hands that I'm actually breaking up the tissue appropriately and not just kind of digging away at it.
Mm-hmm.
I find that a lot of people use Graston a little too aggressively and really
bruise them up,
inflame that area. That's not needed. So there's a time and a place for it, but I'd have to say most modalities just come from my hands. I think that's the best use of time.
Now, one thing we were talking before a little bit, I was curious, you're coaching or helping people in other states. How much of this can you do with visual cues looking at someone? And that's pretty amazing. Did that take some practice doing it that way with visual cues versus touching their bodies?
Right. So a little bit. And you get a lot of information from a patient subjectively. So what they're saying to you actually gives me feedback as to what they're probably feeling. Symptom-wise, usually will lead me down the path of diagnostics, where if something in their hip is hurting, the other side of their spine may be slightly rotated, and therefore the foot is hurting down below because of all of that. Going down that path, I have them situated in front of me on telehealth where I can manage in terms of what I'm seeing, and then them giving me verbal feedback. So I make that hypothesis in my head for diagnosis, and then I have questions that I ask them along the way that either secure that diagnosis or not, and then I can change based on what I'm doing that way.
Wow.
But in fact, watching form and technique's important, because the biggest thing, like if I'm going to give you 4 exercises that I think are the most important, but you do them poorly and you don't have the ultimate technique, it's completely worthless. What you've done for 10, 15 minutes is not going to help you. So I hone in on technique quite a bit with people.
I know some PTs, they use some technology to help with that. Do you have like YouTube videos, or do you record the patient doing it to make sure they have proper form? What do you find what works, and how do you get them to do that?
Right. So a lot of times, either telehealth or in person, it's a lot of verbal cues and tactile cues. So if I see certain movements that I don't want to see, I'll say, you need to feel it here, or you need to be doing this in order to feel it in this other spot. Mm-hmm. For home program management, a lot of the stuff I have people doing, I either have videos on YouTube, or if I don't, I'll create pictures and video and send them to the patient for what they need. So that goes along with communication. I actually don't schedule a second visit upon the first visit, because if I have someone come in and I give them an exercise routine or we do hands-on, I don't know if you're going to need the visit next Tuesday or next Friday. So if I schedule Tuesday, I could potentially be taking time out of your day and money out of your pocket when you don't need it right now. So what I do is I follow up with that person either via email or telephone the following week or earlier if they have questions, and we discuss what's going on. So based on their symptom management with the program I've given, I can better assess the time frame as to when they need a follow-up. And that way we're getting the best, plan of care out of this, where they're not coming in too early and then they're not scheduling 5 weeks out when it's too late.
Wow.
So everything is pretty individualized and assessed, where people aren't wasting time or money.
Yeah. Wow. Well, great, Kim. I think we've covered a lot of things today. Thank you for being so open. I think this was really helpful for those that are watching the program. What's the best way if they want to learn more kind of about what you do and kind of learn about you? Is there a website you would recommend them going to?
Yeah, they can go to my website, which has all the information about what I offer and what I do. And it's ortho, ORTHO, nept.com.
Okay, great. Well, thank you so much for your time.
Thanks, Donald.
Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.